I'm Craig Smaler, RN, Senior Housing Nurse for Newbridge Services, and this is an in-service on infection prevention and control, universal precautions, and the use of the bodily fluid spill kit. Knowing about infection prevention and control with universal precautions is very important information. So let's start with what infectious agents are carried in the blood and in other bodily fluids. The HIV virus is a human immunodeficiency virus that infects a person. This infection causes AIDS, an acquired immunodeficiency syndrome. This virus cannot be caught by casual everyday contact, nor is it an airborne virus. It must be a direct introduction from an infected person through their blood or by sexual contact. The HIV virus cannot live in a dry environment for more than a few hours. A newly infected person will create HIV antibodies in their immune system that can be detected by an AIDS test in about 6 to 12 weeks. However, there is no vaccine for the HIV virus. The HBV virus is the hepatitis B virus, which attacks and damages the liver. This virus cannot be caught by casual everyday contact, nor is it an airborne virus. It must be a direct introduction from an infected person through their blood or by sexual contact. The HBV virus can live in a drier environment for at least 7 days, and thus is a major infectious occupational hazard to healthcare workers. The HBV virus concentration may be sufficiently high enough to be transmitted through the saliva of a human bite and attack then cause damage to the liver of the bitten person. There is a vaccine for the HBV virus that consists of a series of 3 injections that protect you for your lifetime. How are you being protected by these infectious diseases by Newbridge Services? Well, Newbridge has a written exposure control plan to minimize employee exposure. Hepatitis B vaccinations are offered to all staff. If the vaccination was refused at first, by your signing of a written statement refusing the vaccine, it still may be requested any time during your employment. If an exposure occurs, it must be documented through an incident report, reported to your supervisor, manager, director, and to the Human Resources Department. The Human Resources Department will coordinate the post-exposure follow-up, reporting, record-keeping, and medical evaluation. Newbridge will arrange for a healthcare provider to assess, counsel, and treat the person who is the source of the bodily fluids that led to the exposure, and the target person who is infected by the bodily fluid. All information is kept strictly confidential. Other exposure controls which protect you from these infectious diseases are universal precautions, a comprehensive approach that treats all bodily fluids and parts as if they are infectious for HIV, HBV, or other bloodborne pathogens. Engineering controls, such as sharp containers, hand washing, plastic waste bags, red biohazard plastic waste bags, and red biohazard plastic waste containers. Personal protective equipment, or PPE, are disposable gloves, mouth, nose, fabric face mask, full sleeve gown, shoe covers, eye protection goggles, or an eye face shield, all of which are supplied by Newbridge at no cost to the employee. Work practice controls are disposable, as in throwaway after each use, gloves, whenever you're touching any bodily parts or bodily fluids, such as a person's skin, a bleeding person, wet laundry, or cleaning up a bodily fluid spill. If 2 people are bleeding, always change your disposable gloves before touching the other person. And touch a person's skin only with disposable gloves on, no matter what the circumstances are, and with no exceptions. Do not eat, drink, or store any food in an area where infectious bodily fluids, medications, or blood may be stored, such as in the medication refrigerator. Look for the orange-red biohazard label on containers used to store, transport, or ship infectious materials. Wash your hands in the restroom sink and not the kitchen sink. Use hot water and soap, mechanically rubbing your hands together, then rinse your hands with hot water and dry them with paper towels. Alcohol hand sanitizers. They're placed around the facility and in vehicles to allow frequent sanitizing applications to occur when necessary. How do you know when to wash your hands with soap and water or use an alcohol hand sanitizer? Easy. If you knowingly came into contact with infected, dirty, or contaminated things, or can see obvious dirt or contamination on your hands, wash them with soap and water. Otherwise, use the alcohol hand sanitizer. Check your skin daily for any signs of new red, rash, pimple, spot, boil, or an insect bite, especially on your hands, arm, or face. And if you see one, obtain medical advice quickly. It may be a methicillin-resistant Staphylococcus aureus or MRSA infection, usually called a staph infection. Do not itch, rub, or scratch the area because that will only cause the staph to go deeper into your skin and possibly enter into your bloodstream, where it may cause very severe complications to occur. See your doctor immediately. The use of the bodily fluid spill kit. So, to clean a bodily fluid spill, don't wait. Start the process to clean the work surface immediately with appropriate disinfectant and equipment. Assess the situation and put on suitable equipment for the spill. Mouth, nose, fabric face mask, full sleeve gown, shoe covers, eye protection goggles, or an eye face shield. If splashes or sprays or splatters of infectious material may occur. Always put on disposable gloves in all circumstances. And these items are found in the bodily fluid spill kit, a white plastic box that is stored in the office and in each vehicle's trunk. Only after you have put on your protective equipment do you start to clean the bodily fluid spill. So by the numbers. Step 1. Open the bodily fluid spill kit and remove the package of SafeTech Red Z Fluid Solidifier and cover the entire spill with the absorbent granules from the packet. This will instantly bind the bodily fluids into a semi-solid gel mass. Step 2. Use the white plastic scraper, mini shovel, to scoop the semi-solid gelled mass into the clear plastic bag. Step 3. Use the white absorbent towels to contain the remaining fluid from the spill and place the towels in the plastic bag. Step 4. Use a sanitized germicidal wipes to wipe down the contaminated area and place the wipes in the plastic bag. Tie the plastic bag with a twist tie, which is in the bodily fluid spill kit, and dispose of the plastic bag in the trash. Remove your personal protective equipment and last of all, your disposable gloves into the trash before leaving the spill area. Step 5. Use the BKZ towelettes to antiseptically clean your hands and dispose of the towelettes in the trash. Step 6. Finally, wash your hands thoroughly with hot water and soap, mechanically rubbing your hands together, then rinse your hands with hot water and dry them with paper towels. So, what if there's no bodily fluid spill kit available? Step 1. Cover the spill with multiple paper towels. Step 2. Scoop the bodily fluid paper towels into a white plastic bag. Step 3. Use dry paper towels to contain the remaining fluid from the spill and place the paper towels in the plastic bag. Step 4. Wipe down the contaminated area with a 1 to 10 bleach solution of 1/4 cup of bleach to 2 1/4 cups of water, or 1 3/4 cups of bleach to a gallon of water, and place the bleach-soaked paper towels in a plastic bag. Tie the plastic bag and dispose of the plastic bag in the trash. Step 5. Remove your personal protective equipment and last of all your disposable gloves into the trash before leaving the spill area. Step 6. Wash your hands thoroughly with hot water and soap, mechanically rubbing your hands together, then rinse your hands with hot water and dry them with paper towels. Note: bodily fluid such as urine or a vomit which is a person's throw-up of undigested foods from the stomach, are not considered infectious unless there is evidence of blood in the spill. If there is an obvious evidence of blood in the spill, then scoop the semi-solid gel mass into the red plastic bag. To bag soiled laundry, put on disposable gloves, place the dry laundry in the basket first, then place the wet laundry in a plastic bag to prevent leakage on top of the dry laundry and transport the basket to the wash machine. To give injections, put on disposable gloves, prepare and then give the injectable medication, then immediately place the syringe in a puncture-resistant red biohazard labeled needle collection container. If a skin contact or an exposure occurs with bodily fluids, first repeatedly wash, then rinse the skin area for 5 or 10 minutes with soap and hot water. Immediately then complete an incident report that details when and how the exposure took place and what part of your body was contaminated. Next, call your supervisor, manager, director, and the Human Resources Department immediately. You will be instructed to go to a healthcare provider that will perform a medical evaluation, assess, counsel, treat, and coordinate post-exposure follow-up with Newbridge and the Human Resources Department. Remember, universal precautions are a comprehensive approach that treats all bodily fluids as if they are infectious. Always use disposable gloves whenever you are touching any bodily parts or bodily fluids, wet laundry, or cleaning up a bodily fluid spill. Remember to wash your hands thoroughly with hot water and soap, mechanically rubbing your hands together, then rinsing your hands with hot water and drying them with paper towels. When you wash your hands, remember to use the restroom sink and not the kitchen sink. The test for the infection prevention and control, universal precautions, and use of the bodily fluid spill kit. Question 1. The HIV virus is a human immunodeficiency virus that causes AIDS, an acquired immunodeficiency syndrome. True or false? Question 2. The HBV virus is called the hepatitis B virus, which can attack and then cause damage to the liver. True or false? Question 3. A very high HBV virus concentration cannot be transferred through the saliva of a human bite and expose the bitten person to an HBV virus infection. True or false? Question 4. If an exposure occurs, it must be documented through an incident report, reported to the supervisor, manager, director, and then to the Human Resources Department. True or false? Question 5. Universal precautions, a comprehensive approach to expose you to the HIV virus, the HBV virus, or any other blood pathogens. True or false? Question 6. You are using work practice controls when you are using disposable gloves whenever you are touching any bodily parts or bodily fluids. True or false? Question 7. Bodily fluids such as a urine or a vomit, a throw-up of undigested foods from the stomach, are not considered infectious unless there is evidence of blood in the spill. True or false? Question 8. The SafeTech Red Z fluid solidifier is used to antiseptically clean your hands before leaving the contaminated spill area. True or false? Question 9. You can also decontaminate the spill area with a 1 to 10 bleach solution of 1/4 cup of bleach to 2 1/4 cups of water. True or false? Question 10. If a skin contact or exposure takes place with bodily fluids, repeatedly wash, then rinse the skin area for 5 to 10 minutes with soap and hot water. True or false? This concludes the infection prevention and control, universal precautions, and the use of the bodily fluid spill kit in service. Thank you.